It's Wellness Nerd Out time! How you guys doing today? Happy Wellness Nerd Out time. Jameson's very excited. Come here, buddy. Yeah, see, he's all hopped up. He knows when Wellness Nerd Out time is the best time of the day, you guys. And today, we're going to be talking a little more about testosterone. The camera is going down as I talk to you, so I'm going to kind of get low here. I can't imagine how much lower it's going to go. I got to tighten something, but that's okay. So, hey, thank you guys for tuning in. I'll get to you in a second, all right? So, what we're going to talk about today is testosterone production in the adrenal cortex and specifically weak androgens, right? That can become testosterone. And what we're also going to talk about is some of the things that can happen with a like I said, travels down the hypophyseal trunk, adenohypophysis, luteinizing hormone, follicle stimulating hormone are released from the anterior pituitary, aka adenohypophysis once again. Luteinizing hormone travels to the testes, promotes the production of testosterone from cholesterol via Leydig cells, if you're late to the party, all right? So just to kind of pick up where we left off a little bit. And this isn't the only way we get testosterone, albeit it's, how we get the vast majority. Well, I think it's around 5% is also produced in the adrenal cortex, and specifically the zona reticularis layer of the adrenal cortex, all right? And are we producing testosterone itself, precursors, what's going on? Well, again, the vast majority is produced in the testes, but what we do get from the adrenal cortex are what we call weak androgens. And these weak androgens are DHEA or dehydroepiandrosterone and androstenedione. I'm going to get a chair. And androstenedione. So now we have DHEA and androstenedione, which can travel through the blood to target tissues. And you would think bind receptors, right? But before they could do that, first time with this tripod here, I'm doing my best. Keep straightening it for you. So when we have DHEA and androstenedione being produced in, again, the zona reticularis layer of the adrenal cortex, well, they're going to travel through the blood, and they themselves can't bind these testosterone receptors to promote testosterone function via it moving into the cell, right, to promote gene expression themselves. But they can be converted into testosterone, and so when they're converted into testosterone, it can then bind the cell surface receptor and travel into the cell and intracellularly promote gene expression, all right, as we talked about yesterday. So what are some of the things that these weak androgens are responsible for? Well, when we talk about women, and we haven't really talked about testosterone and its effects on women in the past few days, we kind of kept it to males as it is the primary male sex hormone, right? Testosterone in women is responsible for many things, but a few big ones are its involvement in ovarian function, in sexual function, and its involvement and the role it plays in bone metabolism, all right? So this includes, increasing or decreasing bone mineral density, whether we have enough testosterone or too little, in which case we would have decreased bone density, right? So we'll talk about, the effects of testosterone in women more tomorrow, something in my eye, but, today, let's talk about what happens when males have low testosterone levels, or low T as we commonly know it, right? Well, of course we're going to get decreased libido. We're going to get decreased testicular size. We all know that. We get things like, we get anabolic changes, such as decreased muscle mass, such as decreased bone mineral density. And this decreased bone density could put elderly men at a higher risk for fractures. All right. On top of that, low testosterone can also cause a lack of focus and increased irritability. Now, one other big thing that we talked about yesterday is testosterone's role in erythropoiesis, or the production of red blood cells. Is erythropoiesis, right? And so if we have low testosterone, what could happen? Well, maybe we have decreased erythropoiesis then, and we are not producing as many red blood cells, and this could consequently lead to anemia. So low testosterone could even lead to anemia, interestingly enough. Get that fatigue and lethargy in general, and among other symptoms with anemia, of course, right? Now, so what do we do when we have low testosterone, right? So we're talking about the elderly, because testosterone levels drop as we age, right? So, what are we going to do about it? Well, we could make lifestyle changes, and we'll talk about, lifestyle habits that can increase testosterone, diet changes, right? And testosterone's effects in women tomorrow, once again. So we're not going to really touch on it today. But one alternative is hormone replacement therapy, or testosterone replacement therapy. And albeit, TRT could help to reverse some of these negative side effects of low testosterone, like, decreased focus, and more irritability, or, it could, giving us more testosterone could prevent that decline in erythropoiesis, that decreased muscle mass, decreased bone density. Another thing we're going to get with decreased testosterone is increased belly fat, particularly central obesity, so fat around the midsection, right? And, aside from a decreased libido and decreased testicular size, right? Aside from helping all of these, which is a really big deal, I'm sure, to a lot of people, right? We would do just about anything as we age to get our testosterone levels back, and to increase our virility and our masculinity once again, right? But there are some risks to hormone replacement therapy. And one of the major ones, come here, buddy, you all right? One of the major ones is your increased risk for developing prostate cancer. So again, as much as it can help these negative effects of decreased testosterone, low T levels, well, there are some serious side effects and risks potentially. All right, so you got to consult with your doctor if HRT is right for you, if testosterone replacement therapy, again, is right for you. And, you should try all your lifestyle changes and changing your diet habits, your exercise, everything like that first, all right, before moving to HRT, of course. So what do we always say here when wellness? We start with a more conservative approach. You don't dive right into medication or surgery. Sometimes it's necessary. But a lot of the time, if we just change our lifestyle, our diet, we exercise more, right? Well, we can really, really improve a lot of these things that we thought we might not have any hope with. All right, so that's your message of the day about testosterone. We'll talk about women and testosterone tomorrow. And who do we got on here? Mark, what's up, man? I hope not. I don't think you do. Yeah. And Parker, what's up, my brother? How you doing, man? Missed you at work tonight. I didn't see you there. You're probably having a good night. I hope, I want to hear a story from it. Thank you guys very much. Great quick discussion on testosterone. Once again, we'll round it all up, finish it off tomorrow. As for now, you have a great rest of your night, and we'll see you then, people. Happy wellness. Thank you so much. Ant, what's up? I just saw you on here. Bada bing, bada boom. In good grace, what's up? Dana Della Music, DX Alardo, how you doing? Thank you for hopping on. Mick and Teague, thank you. Have a great night, guys. We'll see you then. Ciao.